I started thinking that in my life I wanted to be either an oceanographer or perhaps do something in the medical dental field. I wasn't sure exactly. So I went to college and spent the first couple of years at United States Coast Guard Academy, and we did a few ice dives in the Thames River in Connecticut, and I decided this Jacques Cousteau stuff is not so cool. I don't think I want to do that. And so then I wanted to start looking into going into dentistry or medicine, something where I could, help people. During medical school, there wasn't a single rotation that I didn't like. But the one that it turned out I absolutely loved was obstetrics and gynecology. I found that I really, really, really liked the high-risk nature of pregnancies. And there was a fellowship thereafter, and I became fellowship trained in maternal fetal medicine. And that sort of led me into my first focused and fairly long-term area of interest in terms of the pharmacologic treatment of preterm labor and exploring and introducing to the United States nifedipine, which is this calcium channel blocker, which the Norwegians and the Swedes were using at the time. So I had an indirect path as I moved through medical school, and actually even before medical school. But after I finished medical school, went out to San Francisco, was there in San Francisco for internship, and then Stanford for most of my residency, and then came back to Wake Forest, which was home at the time, and here for a couple of years, then went back to Stanford because my focus and my practice, I think, had begun to shape what I was interested in, and that was maternal fetal medicine. And after the fellowship at Stanford, was recruited to Virginia, and at Virginia I found that I not only liked taking care of patients and teaching, but I also liked to ask questions and get involved in research. As that went on, I was engaged and asked to be involved in different leadership positions and organizations and the like.
When you're in a state like Virginia or other places that he's been, where you're looking at higher maternal and infant mortality rates, his leadership in the state and leadership nationally have really kind of carried through. And so this is both of the big role that he played in maternal fetal medicine. But he also played a big role in training future leaders, residents and fellows who went on to carry the mantle for the things that he believed in and that we all believe in from the perspective of women's health care.
I like being able to help create an environment where there's good learning, good research, good teaching, and then came back to Virginia and had the opportunity to slow down and retire at home and look back and try to stay out of everybody's hair at work, but still enjoy walking around town and meeting patients that many years ago I helped take care of, or their children who I had delivered and that type of thing. I would not be able to do the things I did without my family, friends, mentors, the whole drill in terms of everybody around, because it takes a team, and the fact that the mentors, I think that's one of the most important things we do in medicine, is mentor students and residents and faculty, and it's very fulfilling. And I was very lucky to have good mentors, at Wake Forest and thereafter.
Really throughout my career, Jeff Ferguson has modeled the importance of excellence in everything that we do. He provides a really incredible example of a humanistic physician, someone who learned from mentors who impressed upon him the importance of the relationship with the patient and not just the medical care. And he really passed that trait on to his trainees and his fellow faculty members.
And there are healthy babies and there are healthy moms, but there's too many times when it's not that way. And I liked that because there was a giant opportunity to help, like with premature labor and trying to help treat that, or learning about prenatal diagnosis and is there an affected child or not with something, or how do we improve a condition. I mean, it was an opportunity, and maternal fetal medicine was a relatively new subspecialty. I mean, it was only founded in 1975.
I think he basically assesses situations, makes decisions from an educated point of view. You may not always like the decisions, but he'll be very clear on why he has made that decision. Once he makes a decision, he's headstrong on moving forward. He's determined to help and support other people in being successful within academic medicine. And I think he's also eager to be sure again in teaching residents and medical students to hopefully become the best physicians that they can become.
I would hope that patients, for instance, knew that I gave my all for them. I was trying to do everything I could, and I was putting their needs ahead of mine and my family's. And I would hope that my faculty and learners recognize I always felt like their success was my success. And if they were successful, that made me the happiest in the world. If they learned something they didn't know, if they gained some skill they didn't have, if they developed as a faculty member and were promoted or became an excellent, physician of renown, that's, I think, what would make me feel the best, if knowing that those individuals knew how much I cared about them.